thank you, and welcome back to my channel. As you know, my name is Dr. Ifedayo, Heal to Heal. And I'm sure you are like, oh my God, there's a celebrity beside me. Yes, there is. And beside me is Prof. AFUA HESSE. Okay, I'm trying to contain my excitement. So we are here at Accra College of Medicine. We're going to answer all the questions you have about Accra College of Medicine, how to get in, what the student life is like. So you need to stay tuned, subscribe, like, and share this video to everyone that would be interested. Thank you. So here with me is Prof. AFUA HESSE. She was born in Kumasi, and she had a secondary level education at Wesley Girls Senior High School in Cape Coast, the famous Wesley Girls. Yes. Then she followed her education at the University of Ghana, where she trained to become a medical doctor. Yes, and she is actually a fellow of the Royal College of Surgeons, Edinburgh, UK, and the West African College of Surgeons, as well as Foundation Fellow of the Ghana College of Physicians and Surgeons. Wow. She's also a Fellow of the International College of Surgeons. She holds a Level 8 Diploma of the Chartered Management Institute, London, UK. Wow. She also holds a certificate in Health Management Administration for senior health practitioners from Ghana, from the Ghana Institute of Management and Public Administration, a certificate in Health Management, Planning and Policy from the University of Leeds. She is indeed one that, I feel very honored to be sat beside Prof. Wow. She's a woman of many firsts, actually. She was the first female pediatric surgeon in Ghana. Can you imagine? As well, she's the first woman surgeon from her alma mater and served as the president of the Medical Women's International Association, another first for a Ghanaian in the 91-year history of the association, which is the first international professional women's association. She's a professor of surgery, as I said, at the University of Ghana Medical School, and has served in various capacities at both the medical school and the Kolebu Teaching Hospital with over 3 decades of experience. I'm not even up to 3 decades on earth. Wow. Wow. She was the first female to serve as head of Department of Surgery, Director of Medical Affairs, Head of Pediatric Surgery Unit, and subsequently the acting CEO of the Kolebu Teaching Hospital. She's the first female honorary secretary of the Ghana Medical Association. She actually lectures at both undergraduate and postgraduate levels at the University of Ghana Medical School and is a reviewer of various international peer-reviewed medical journals. She has undertaken several assignments, including serving as a consultant for the Ministry of Health, serving on boards of some companies and tertiary institutions, and the Ghana Medical Association, and also university communities in various capacities. Wow. Currently, she is the co-founder and president of this prestigious institution, Accra College of Medicine, Ghana's leading private medical school, which has produced its first cohort of doctors in 2020. I think we need to take a breath here and take it all in. So with me sits greatness, and I want you all to say hi, and Prof, welcome.
Thank you. Thank you.
Really honored to be sat beside you.
Whoa.
Wow.
That sounded like, whose CV are you reading?
Like, I feel so honored to be sat beside you. You know, let me throw this in fun fact. My first clinical final, part 1, Prof was at my Viva station, and the question you asked me was on necrotizing fasciitis. And everyone, when people were coming out of the station, everyone was having this look on their face like, oh my God, who is in there? And then I got in there, and that was the exact thing I'd read that morning. So when she asked me, I was like, so necrotizing fasciitis is there? She was like, and then she adjusted. I'm like, okay, I think I have her now. It was such an amazing, an amazing way to have a first time encounter with you, actually.
That is fantastic.
Yes.
Well
so I'm actually so honored and blessed to be sat beside you today.
Thank God.
Yes,
it's all glory to God.
Yes, please. Today we'll be asking the questions, and then Prof will do all the honor of answering. Okay. So sit down, relax, and let's get this started. So what does Accra College of Medicine offer?
Right. Well, Accra College of Medicine runs purely medical program at the moment, and it offers training towards the MB CHB for both undergraduates and people with a first degree as well. Okay. That's what it offers.
That's amazing. And I know you guys know that I have a first degree. Yeah, so I would have fallen under the second category for those who are confused. So let's zoom in on the medical program. So what is it about, the 2 entry pods you
All right.
mentioned.
So undergraduate training is for those who basically in Ghana come with a WASI.
Yeah.
So the West African Senior Secondary Certificate of Examinations, provided you have good grades and you do it in science.
Yes.
And then also those who are running the International Baccalaureate, the IB programs. Then also those who have O and A level qualifications.
All right.
From other countries, you can also come with the equivalence of your national exams. The only proviso is that the Ghana Technical Education Committee, GTEC, would have to vet your degrees or your certificates to make sure that they're equivalent.
Yes, that's only fair. Yes. So, what are the exact actually admission requirements? Like the A's, how many A's should you get? Some people tell me for the graduate entry program, I've gotten a second class, or do I have to do exactly biological sciences? What are the exact admission requirements required?
Science-based programs.
Okay.
For first degree.
Yeah.
And a minimum of a second lower.
Okay.
Will be acceptable.
Yeah.
The reason for that is those who come with grades that are lower struggle so much.
Yeah.
And they have so much difficulty getting the concept. So it's really for the good of the students. If you don't do so well, go and better yourself before you come, because it takes a lot out of you. For the WASI, the GTEC minimum is 24. So for admission into any university. So depending on the numbers that are competing for the places, we will consider science in that level. But of course, the higher you get, the better it is. Your chances of admission are.
So may the best man win. So if you know you are there about to write your WASI or whatever, you need to push your head in your book.
Just push.
Yes, you need to push, because if you have to get into study medicine here, you have to be one of the best. Okay, so how many graduates has the program produced so far?
Right, 2020 we graduated 6. They were the pioneer class.
Yes.
Then 2021, 11, you know.
That's
an increase. Yes.
Yes.
They were also pioneer class, but they came in at the undergraduate level. The very first class started at level 200, and the second group started at 100.
All right, that's actually amazing. So what's the success rate actually of the students?
I'm not sure what you mean by success rate. What happens here is we run a semester system.
Yes, please.
And we have a certain number of courses that are required and taken in each semester.
Yeah.
So every student has to pass the courses for the semester.
Yes.
You are, I don't know whether it's entitled, but you can fail up to 6 courses for the year and still have a chance to take them at the resit, which happens at the end of the year.
Okay.
But if you fail more than 6 courses, then automatically you would have to repeat the year.
Okay.
It's really for your own good. And the pass mark for ACM, just like it is for University of Ghana, to whom we are affiliated, is 60%. So you have to work harder. It's not 50%, because you want to have a minimum of 60% knowledge about the human being before you go and claim to be a doctor.
That's very fair. That's very fair.
You cannot afford to make mistakes on people.
Yes.
So we have to maintain a higher standard.
That's actually fair.
And I must say that over the course of time, maybe maximum between 5 and 10% of a class would have to take resets.
Okay.
I think even 5% is a higher average, because we give you many opportunities. You have IAs, that is interim assessment, and we have lots of resources to help you to catch up academically. We have a very good counseling unit which boasts of a learning psychologist who takes one of the courses, which is called learning methodology. So we try to help you to learn the best way that you can. In medical school, true pour doesn't work. You have to understand the principles. When you understand the principles, then you're better able to apply them in whatever form you may come across them. So that is very important for us. And we have a mentorship system which helps you with mentors who are faculty, who are also experienced, who've been through medical school.
That's true.
And therefore can advise you when you come against hurdles and bumps.
Yes.
And can help you with your learning methods. Your first semester is usually your most crucial.
Yes.
You are adapting to a new system. If at the end of it, the way you have done it doesn't work, if you continue like that, you are aiming for failure. So you then need to be helped. Year 1, a long semester break. Year 2, semester break. Year 3, you have the opportunity to do those, we call them selectives.
I actually feel like, from my own experience as a Nigerian who has schooled in Ghana, yes, it is a bit of a challenge to actually communicate with some of the patients when they don't speak English. And also, in my practice as well, I've seen we have had patients coming from the neighboring countries that we have to find someone who speaks French. Then also there are sometimes they've just called me hurriedly. Can you come to the E&E? We have someone who is speaking Yoruba. And I'm like, the whole of Kolebu. And I'm the one you're calling to come and interpret for you. And then sometimes they call me and I'm like, this person speaks Igbo. Unfortunately, my Igbo is very infantile. Like, it's not great at all. Let me call someone else for you. So I think it's actually a very good idea. And the sign language is very key. It's very key. I feel like they are like they're a group in our community that is just like, nobody really thinks about them, and healthcare for them is very important because they are functioning just like the rest of us as well. And then the musical instrument is good. It's a good way to not burn out, somewhere to divert the stress. And
exactly,
yes, that's actually a very good idea. I wish I did some. So, but okay, that's actually good. So, what's the student to lecturer ratio here in the ACM?
The maximum size of class is 35.
Okay.
So the faculty is, I don't know, we have a lot of full-time and part-time.
Yes.
We have a lot of those. So the ratio, we don't have a problem with that at all.
Okay. And the class is 35. And I'm pretty sure they have very close contact with their lecturers.
Yes, they're able to ask them, contact them at any time, get information, get questions clarified. All of that is readily accessible to them.
And personally, from my own medical school days, I felt like once the lecturer knew your name, you felt obliged to do well in the exam, even if it was your index number on the thing, because when they compile it, the index number and the name will follow. They're like, oh, Abe. I'm like, okay.
That is certainly very true.
So I think that is actually a very good one. A small class size is actually
but
very
don't
good.
make the mistake. We don't relax any of the rules because we are small.
Yes.
And because we're private.
Yes.
We do not. We are very strict in the way we teach, with the standards.
Yes.
That have been set. We are accredited by the Medical and Dental Council. Yes. So they ensure and enforce standards, and our standards are among the highest in the country. That's actually very important to note. And seeing all your achievements, I do not think you got here without discipline. I expect that, and I know that discipline is actually transferred in the way this place is run. So yeah, I mean, where you've gotten to, it is not now you're about to try to compromise anything. Exactly. No, we're not compromising anything here. So now, how are clinicals done here? Right. So we run our programs based on the North American model. Okay. There, you don't usually have affiliated university hospitals, teaching hospitals, and medical schools. Okay. But you use campuses of established hospitals, institutions. That then gives us the opportunity to also interact with the private sector, which we are. So our students get the opportunity to visit private institutions, see how the practice there may be different from the practice in the public sector. Okay. And they get a taste of both worlds. Yeah. The clinicals, the main training institution is the Great Accra Regional Hospital. Okay. But we do some of the courses at the Kolebu Teaching Hospital. Okay. We do some at Pantang. Yeah. Psychiatry, mental health. Then the private facilities, we have Women's Hospital, we have Medifem, we have Sinel Hospital, we have Rabito Clinic, where a lot of the dermatology is done, but we also do dermatology at 37 military hospitals. So it gives us the flexibility to be able to have a memorandum of understandings with as many institutions that the Medical and Dental Council approves as training facilities. Yeah, and personally, from what I just got from here,
if you're a student and you're exposed to all these institutions, if you know what's right for you, you make connections, you network, so that when you get out of school, you have a rich pool of people to, guide you or mentor you based on what you want to do. So I think you should think about that. I think you should actually think about that. Think about that. I'm just throwing that out there for whoever hasn't clocked on yet. So now, let's talk about what's important. Money. What are the fees like? International and home students.
We have just one set of fees for both international and local.
Wow.
Right from the beginning.
Wow.
That was our decision.
For the first time, I did not feel like I've been... Yes.
No, we don't.
Yes.
We don't. Because when you're all together, you're all doing the same thing. So we don't discriminate in that regard. And if you are able to pay all your fees in one go, it's 10,750 if you pay it all in one go.
Oh.
If you don't and you take a payment plan, which allows you to pay up to from 3 to 6 installments for the whole academic year, then the total by the end of that period will come to the CD equivalent of $12,500.
That's actually very decent. Actually, it's way cheaper than I thought it would be.
Yeah, it's certainly much cheaper than going to the US.
Yes.
For what you're going to get, for the variety of cases you're going to see.
Yes.
For the scope that you're getting.
I mean, I've been an international student all my life. So actually being told that there's an institution that would not separate me fee-wise, I kind of feel there's a warm feeling inside. I don't know how to explain that. I feel real good right now. That's actually nice. That's actually a good thing. That's very impressive. Are there any scholarship or student aid programs accepted or offered by the school?
Right. We are pretty young.
Yes.
And so not as yet, except for one that we're offering for participants of the National Science and Maths quiz. We give one full tuition scholarship for a year for any of the students that can reach a certain level. I think it's semi-finalist or even quarter-finalist of the National Science and Maths quiz. So we have 3 such students in the school. We are setting up a financial aid fund which will look at helping. The Scholarship Secretariat does support. So it's a question of getting your application in and going through that process. Debt fund also, and there are other private which may support in part and which would then help students along. Yes.
That's good actually. I mean, full tuition?
Yes.
You're doing well. Amazing. Amazing is the word. Well is trying to downplay it. Amazing is the word.
We thank God.
That's
we
really
thank God. Yes.
So are there any plans to expand beyond medicine, maybe the other life science, laboratory medicine?
Yes, I think with time. What we are looking at is consolidating medicine.
Yes.
What we would like to move on to is to produce what we call physician scientists. So people would be able to do, with your MD-CHB, you could do an MPH, you could do an MPhil in any of the basic sciences or the paraclinical sciences, and come out with that, and then move on to do a PhD in that, and move ahead. If you didn't wish to go into the clinical area, but wanted to stay within the lab science area. Yeah. Yeah. So those are part of our plans for the future. And then, who knows? Maybe down the line from that, we would move into other paraclinical specialties. But we want, whatever we want to do it well. So it'll take some time to get that consolidated. Then as you expand, you then move on to subsequent areas.
I'm actually very excited for the future. Like this year, I can't wait to see the institution grow. And I hope I'll be part, to document it and be here when you're having your fest.
Amen.
And then I would actually dance there, the wildest. Wow. Okay. So why Accra College of Medicine over any other program? Why should anyone watching?
Well, after what you have heard, Where else would you go?
Fair point. But that's what you say when you're so sure of your stuff. I mean, now what you said, where else do you want to go to? That is very, very, very fair. That's very fair. Are there any other things you want us to know about Accra College of Medicine?
I think that in the grand scheme of things, it is also a place where you can ground yourself in proper ethics in medicine and professionalism. If that's what you want, if you function better in an environment where your classes are smaller, that may be the place for you, because we then are able to concentrate and help you become the best that you can be. And we're able to offer you the necessary support. So, over to you.
Thank you very much. That was an amazing interview. I'm sure I and everyone watching this feel very honored. I've actually seen your face on our screens, and then the information has been vital. I wish ACM the best, and please stay tuned for other videos. We'll take a tour of the university college. We'll also interview other students, so stay tuned. And I think we'll be interviewing one of the awardees.
Yes, the National Science and Maths Quiz.
Yes, so you want to stay tuned and subscribe and share the videos wide. Thank you very much. Thank you very much.
Thank you very much for your time and for having us and talking to us. God bless.